Hi, Amy. Thanks for joining us today to talk a little bit about complex cases. There's a suspicion on my part that there's some underlying biological component to what's presenting as a mood disorder. And as a nurse practitioner, I'd love to hear a little bit about what you're seeing. I know you work with children, I know you work with women quite a bit, and you deal with some of the most complex cases.
I do. I definitely inherit complex cases. The kinds of patients that I tend to see have been through the medical system and are too complicated, or there are too many moving parts to be able to address in a typical medical appointment.
And so with the case that you've worked on, let's say where there might have been a food allergy issue or some other viral or bacterial issue, have you seen, as that's resolved, a real shift in, let's say, sleep patterns and mood patterns?
People who have some type of other inflammatory illness going on, very often that can manifest as a sleep disruption or certainly anxiety, even if it's just a major dietary imbalance, because some foods tend to be more inflammatory, some foods tend to be more stimulating.
What I've seen a trend in psychopharmacology, especially over the last 5 or 7 years, is more and more patients coming in on these new novel pharmaceuticals that they're adding as adjunct therapy to what we used to look at as the standard, SSRIs, SNRIs, and they are giving these new drugs that in the past were used for things like seizures, like a Lamictal drug, for instance, and what that's affecting is glutamate.
Right.
So I always wonder when somebody comes in and that was the magic sort of bullet in their pharmacology, that is there some other deeper issue going on, in which case I often like to collaborate with their health team at large, because I don't think we can approach it from one system.
And I also, like, we do a lot of neurotransmitter testing, and I see so many glutamate issues, which are really process issues. It could be methylation or other kind of detoxification issues, and that's a whole nother component or a whole nother way that a person can arrive at anxiety or sleep disruption is because their detox pathways are not dialed in, or maybe they're overloaded.
Yeah, lots of considerations. And again, the whole system approach that you're taking is going to impact mood, it's going to impact behavior, it's going to impact sleep, it's going to influence many aspects of their life. So thank you for joining us today, Amy. And thank you for the great work you're doing with the patients that you're working with. Thank you.
Thanks for asking me.